Dr. Melnick, sleep apnea. Sleep apnea is, it can get worked on from many medical professions, and there are many ways of doing it, and the dentist is one of them, and not a bad one from what I know. Tell us all about it.
Well, first of all, let's talk a little bit about what apnea is. Apnea is either the brain telling the body not to breathe enough, that's central apnea, and then there's obstructive apnea, meaning the airway gets closed. Oftentimes, patients who are snorers may have airway difficulties. And if you hear your spouse, like it sounds like they're choking at night, they may have apnea. Now, apnea means you stop breathing for 10 seconds or more, one or more times per hour. And depending on how many times that is, the more frequent that it happens, you go from mild, moderate to severe apnea. Now, why that matters is that oxygen and air is very important to the body. When we're sleeping, the body is supposed to be replenishing and resting itself. If you're not getting oxygen, you're not replenishing yourself. If you're not getting a good night's sleep, you wake up the next day and you're tired. Your body doesn't feel good. You're not going to perform at the level that you should. But even more importantly, people who have interrupted sleep will gain weight, will be more subjected to depression, will have a higher risk of heart attack, stroke. In general, it is going to shorten your lifespan. You will meet your maker sooner than you need to. So there are a variety of ways to treat obstructive apnea, but we don't know whether you have it or not unless you go to a sleep doctor and are tested at a sleep lab with a monitor. You have to be tested and diagnosed before you're treated. Now, treatment falls into a variety of categories. The gold standard for obstructive apnea is something called CPAP. It's a continuous positive airway pressure. It's a machine that blows air into your nose at a high pressure to overcome the resistance, the obstructed airway. The compliance, meaning how patients use the CPAP, is not as good as it should be. It's actually pretty low. So some patients get the CPAP but don't use it. Others use it sometimes. Having a CPAP machine isn't going to help you. Using the CPAP machine will. So if patients have problems wearing it or they find it too constricting, they have two other options. One is surgery. There are a variety of surgical options. Many of them are unpredictable. Only one, by maxillary advancement, which is a very advanced and very technical surgery involving moving parts of the jaw forward to open the airway, is predictable, but not everybody wants to undergo surgery. So a third option is how doctors like Dr. Miles and I get involved with our colleagues in the sleep community. We work with the local sleep doctors by making oral appliances that reposition the lower jaw to help open the airway to allow people to overcome an obstructed airway. Typically, they're called mandibular advancement splints. They're two-piece appliances. You wear something over your upper teeth, something over the lower teeth, and when you're sleeping and your jaws are together, your lower jaw is repositioned in a more forward position, which allows the tongue to come more forward, opening the airway, allowing the free flow of air into and out of the lungs. And by treating the patient, it will significantly help this patient sleep through the night, lower their blood pressure, get a better handle on their weight, lower their risk of heart disease and stroke, and in essence help this patient have a higher chance to live a long and fruitful life. This is a huge growing problem within medicine. We get a lot of referrals from sleep doctors and cardiologists from people with uncontrolled high blood pressure. This is a major growing part of healthcare.
with no doubt, and maybe this is all connected to obesity, overweight, and all kinds of other problems. I mean, it's probably not the only one, and one can trigger the other one like a domino effect. But you mentioned something very important, that the gold standard is the oxygen machine, which pumps oxygen in it. And I remember a bunch of years ago, I asked a sports teacher, I said, look, what exercise is the best? There's always this list in the New York Times, which exercise is best and all that stuff. So this guy was a relatively successful sports teacher, and I asked him, and he says, Helmut, the best exercise is the one you will do. And that's very profound, I was thinking, because it's true. I mean, if you don't do it, it don't do any good. So with the gold standard machine, since it's complicated to sleep, it falls off. People, toss and turn. So it may be better than anything else, but if you don't do it, it don't do you any good. So the second best, which is, I call it the mouth guards, what you described, since I cannot pronounce the words you said. So you put those mouth guards in, and your tongue gets put in position, your whatever happens, and all of a sudden you can breathe. It may be second best, but because people will do it way more often, it automatically becomes first best.
Well, for mild and moderate obstructive sleep apnea, with the compliance rate, oftentimes the oral airway therapy or the mandibular advancement splint, the oral appliance, winds up often working better. But I don't want to dissuade people from using a CPAP if it's ideal for them. Right. Sometimes we also do a combination of both. Right. If we make an oral appliance and open the airway, then when they use the CPAP, we could actually turn the pressure of the CPAP lower, because we don't have to have as much resistance to overcome when we're blowing the air into the patient. So, again, I never want to talk a patient out of using a CPAP, but if there's a number of reasons why patients don't. So if they're not going to use it, I certainly want to get them on an oral airway appliance.
Right. Well, that was my point. It's like, yes, there's, if that particular gold standard, if you can live with it, if it's okay with you, go ahead and do it. And if not, go and do the other thing, because getting enough oxygen must be having some importance level, right?
Absolutely. Try living without oxygen.
Yeah, and even for a few seconds, because you can hold your breath here and there when you go swimming and diving for a few seconds, but that's not like 2, 3, 4 times an hour for 10, 15, 20 seconds not getting it. That adds up to a lot of, perhaps brain damage and damages in the body. Good.
Well, we have a saying in the sleep community: airway is king.
Okay. All right. Well, again, it's amazing how much dentistry influences the overall health of a body. It's just absolutely amazing. It's stunning to me. Dr. Melnick, bye-bye.